But it's been, as the gentleman suggested, the American way for all generations before us, that the next generation has been in better shape, if you will, been left in better condition. And it's certainly not that you and I and people in this room don't want things to be worse for our grandchildren, but if we're not careful about how we build this public policy, things are going to be worse. And I would argue we have not been careful, that we are running a deficit this year alone that was unthinkable 6 months ago. Unthinkable. And that national debt I mentioned, unimaginable that we could possibly consider that, and so our grandchildren are going to be in
the experience of other countries with nationalizing their health care. Has that been an inexpensive experience?
Well,
my understanding is it's about broke the budget of people that have tried to do this thing. I do know that Massachusetts tried it and Tennessee tried it. And the experience that they had was, it was expensive. Massachusetts health care costs have gone up like a skyrocket. In Tennessee, the doctors just about left the state. The Democrat governor that tried it as a trial project was followed by another Democrat governor who called it an unmitigated disaster. The head of Canada just declared their socialized medical system a complete mess and a disaster also, and very expensive.
If the gentleman would yield just one more time, because in Minnesota, our neighbor to the north is indeed Canada. And I'm very proud to say that Minnesota is a destination state for health care. We have one of the most famous hospitals, clinics in the world, the Mayo Clinic yeah. in Rochester, Minnesota. And the thing about Canada is, if they can't get care in Canada, if they get tired of waiting in line, which they do wait in lines, and they are denied care, they come see us in Minnesota. So it's expensive in Canada. There's no, to the gentleman's point, it is indeed expensive, but I'm arguing worse than that, it doesn't work for them. For many, many of our Canadian neighbors, they cannot afford to wait in those lines.
They said it's got, I was told by some Canadians, it's the best health care system in the world as long as you're healthy.
And if you're not, you come to Minnesota.
Minnesota.
So I take the gentleman's point.